I think the ayes have it.
I beg to move that this House do now adjourn.
The question is that this House do now adjourn. Theresa Villiers.
Thank you, Mr Deputy Speaker. My constituent, Lisa Rutter, is the founder of the charity Dementia Club UK. This hosts events in Barnet for people with dementia and their families to provide support and advice and much-needed time out of the house socialising with other people with coping with similar life experiences. And this work gives Lisa great insight into dementia care and the pressures on unpaid carers. And she asked me to meet a group of them over Zoom to hear about the traumatic experiences their relatives had when admitted to hospital. I found that meeting deeply disturbing, which is why I have tabled this debate this evening. In the time available, I can only include brief points about each case, and I cannot hope to convey the emotional impact of the stories as told by the carers themselves, and I cannot really hope to get across their real sense of distress and anger that their loved ones had been let down. But I hope to give the House an indication of the seriousness of the problem. Starting with Lisa's own story, her mother, Theresa Gabriel, was admitted to Barnet Hospital with COVID in November 2020, and sadly she died shortly afterwards. Theresa was a lovely lady who I met on a number of occasions. She was assessed by the hospital to be 8 on what's known as the Rockwood scale, meaning she was viewed as severely frail and approaching the end of her life. Lisa believes this diagnosis was entirely wrong. Her mother was sitting up and alert when admitted and did not have serious comorbidities apart from advanced dementia, which meant she needed help with eating. When Lisa was told by the hospital that her mother needed an oxygen mask, she asked them to put Mrs. Gabriel in hand mittens to prevent her pulling off the mask and harming her treatment. The hospital refused on the basis that this didn't accord with hospital policy because it amounted to a deprivation of liberty. They decided it was not proportionate or in Mrs. Gabriel's best interest to be given mittens. This is despite these being used when Mrs. Gabriel was admitted the previous year for a hip operation. Lisa sincerely believes that mittens could have saved her mother's life. Another deeply distressing aspect of this case is that COVID visitor restrictions in place at the time meant that Lisa only had very limited time with her mother in hospital. I raised this in Parliament at the time, urging visitor restrictions to be eased for patients with dementia, and I very much welcome the subsequent introduction of greater flexibility for people to spend time with their loved ones in hospital. We must never again return to restrictions of the sort we saw during the pandemic. Some of the group I spoke to didn't want to be named, so I'm going to refer to them simply as carers 1 to 5. Unlike the others, Carer 1 is not a constituent, and his experience does not relate to my local hospital in Barnet, but I didn't want to leave him out. He emphasised how crucial it is that people with dementia continue to move and walk if they're to stave off further loss of cognition. But he told me staff at the hospital his wife was admitted to refused to help her to walk. Even more worrying, he had to intervene twice to prevent a nurse giving her the wrong dose of medication. Had he not spotted the mistake, a potentially lethal dose could have been administered. Yes.
I'm grateful to the Right Honourable Member. I congratulate her on securing this very significant debate because dementia is going to affect so many people's lives in the coming decades as more and more people are of retirement age. In Devon, the dementia specialist Jonathan Hanbury has suggested that we should place more funding and focus on community hospitals, community treatments, community services, so that people can keep their brain agile further upstream. And he suggests that the NHS focus on funding for acute hospital services and expensive drugs misses the value of prevention. I wonder whether she agrees with that.
I think those are very valid points, and certainly It's really important to keep people out of hospital as often as possible, but that is particularly the case with dementia patients, given the dislocation and the insecurity that comes with moving them to a different environment. So measures to keep people healthier for longer and to deliver care via the primary care system rather than in acute hospitals is an important way to address some of the problems that I'm outlining in the debate this evening. Yes.
Can I commend the Honourable Lady for chipping Barnet bringing this forward? Over the last couple of years, I've had a number of these incidents, and the Honourable Lady has outlined the one that she refers to. But does the Honourable Lady not agree that the emotional upheaval of being taken from a safe place where those with dementia and Alzheimer's feel comfortable will often lead to the patient becoming incredibly distressed, which can in turn result in aggressive behaviour? I know of one young nurse who had her arm broken 2 places. It wasn't the patient's fault. The patient was simply past himself and he couldn't let go of her. But does the Right Honourable Lady not agree that there must be enough staff in place that one young nurse shouldn't be left screaming in pain and no one there to help her, and that this patient deserves compassion and understanding for their outburst?
He does make a very important point, and one of the problems that emerges from some of these cases that I'll talk about tonight is that sort of disruptive behaviour by patients with dementia, shouting, can often be just an attempt to communicate, and it is vital that staff understand this. And of course, I agree that it's essential that we have sufficient numbers of staff that they can give appropriate attention to patients with dementia in these circumstances. Mr. Deputy Speaker, the father of Carer 2 died a month after being admitted to Barnet Hospital. This constituent reported that food and drink were often just left in a tray with little apparent effort by staff to feed her father. He was left all day in a chair or in a bed with no attempt by staff to encourage him to walk. He was not supported whilst in the toilet, and when this led to distressing and undignified consequences, including the soiling of his clothes and hands, he was not washed until the following day. Carer 3 told me that her husband's condition deteriorated significantly during a stay in Barnet Hospital. The nurses apparently complained and said that he screamed all night. My constituent explained to them that this meant he wanted to get up to go to the loo, but was prevented from doing so by the sidebars on the bed. He was simply calling out for help. She often found food left untouched, and yet no one seemed to note that her father had stopped eating. The catering staff just took away the uneaten meals. His medication was also stopped without his family being told, leading to a worsening of his symptoms and his anxiety. Carer 4 told me about her partner, who has early onset Lewy body dementia, who was admitted to Barnet Hospital in April 2022 after a fall. Until that point, he was apparently walking, climbing stairs and coping fairly well at home, albeit that he was a little wobbly on his feet. But the last time he ever walked was when he arrived at Barnet A&E. My constituent was initially restricted in visiting hours and had to fight to be allowed to stay in the hospital outside those times. She felt that the staff didn't understand her partner's care needs, especially some of the agency workers. She was given the number for the specialist dementia nurse covering the hospital trust, but the phone was never picked up, no matter how often she rang it. During his stay in hospital, her partner deteriorated far more quickly than he had before. He was kept in bed constantly and he lost the ability to walk. He is only 55. At one point, after undergoing an MRI scan, he was left distressed and confused in a cold hospital corridor in a hospital gown, left damp with urine after radiographers removed incontinence convene equipment. After he got out of Barnet Hospital, he said he would never ever go back, no matter what the circumstances. Carer 5 told me about her father, who was admitted to Barnet Hospital with pneumonia in November 2021. An ambulance was sent to pick him up and he was able to walk downstairs without any assistance and climb into the back. Throughout his stay, it was extremely difficult for my constituent to get to speak to any doctor or nurse about his care.
Move that this House do now adjourn.
The question is that this House do now adjourn. Theresa Villiers.
Thank you, Mr Deputy Speaker. Throughout his stay, it was extremely difficult for my constituent to get to speak to any doctor or nurse about his care. She became increasingly desperate to take her father home as his condition deteriorated. He had always been meticulous about his personal hygiene, an old-style gentleman who always dressed in a shirt and tie, no matter what the occasion. After time in Barnet Hospital, he was unshaven and unkempt, and he stopped eating. It apparently took 6 months for him to return to something like his old self, and his appetite never returned to what it had been, and he's since passed away. Themes emerging again and again in my discussion with this carers group included repeated difficulties getting to speak to nurses or doctors about the care needs and health of their loved ones, failure of staff to understand the care needs of people with dementia, failing to ensure patients ate or drank, and failing to keep patients mobile and walking. It is also clear from what I've heard from my constituents that allowing extensive visitor access is crucial for patients with dementia, so relatives can help communicate with staff and also assist with feeding and care. And as I said, we must never again tolerate the kind of restrictions on that which we saw during COVID. But communication by doctors and nurses to relatives must be improved as well. And the group I met asked that the NHS develop a much larger volunteer programme, training many more people to support dementia patients with eating and walking if they don't have family there to help them, to train volunteers to help advocate for dementia payments if they don't have relatives who are able to do that. These cases also, I believe, Mr Deputy Speaker, show a need for a much more in-depth and effective training programme for NHS staff on how to look after patients with dementia. And I particularly commend the training programme on understanding dementia, which Barnet Council has commissioned my constituent Lisa Rutter to carry out. And I would urge the local NHS services to consider taking part in that programme. And as I said before, we also need to do as much as we possibly can to keep people healthier for longer and ensure that when they do get ill, there's an option for treatment in the community to keep as many people out of hospital as possible. But I also want to emphasise that I do appreciate the efforts being made by frontline NHS staff to care and support people with dementia. Whilst there have been some very serious failings in the cases I've referred to, I appreciate that thousands of people spend time in Barnet Hospital every year and receive the best quality care. And I thank the NHS workers that make that happen. I also accept that currently there is great pressure on staff as healthcare need continues to expand exponentially, and the NHS also undertakes the massive task of catching up after COVID. When I raised these cases with Barnet Hospital, they emphasised their commitment to ensuring patients with dementia and their carers have the best experience possible. They told me that they've set up a dementia service in 2016 managed by a dementia clinical nurse specialist. In 2023, the hospital apparently treated 356 patients, trained 1,598 members of staff, and received some very positive feedback from patients and carers. In 2015, they were one of the first NHS trusts to sign up to John's campaign to ensure carers can visit patients with dementia at any time outside visiting hours by prior arrangement with the ward manager. They provide dementia training above the expectations set by NHS England, including mandatory Tier 1 dementia awareness training on induction. Specialist dementia training is also provided to volunteers. To support patients during meal times, they have a red tray system in place where patients who need additional time, encouragement or assistance are identified and provided with a red tray. In 2017, they launched a Keep Me Moving campaign which focuses on keeping patients as active as possible while they are in hospital. There is a phone line for carers and loved ones to contact dementia clinical nurse specialists. And whilst I recognise the value of these measures and I welcome all of them, I'm afraid the cases I've outlined indicate that they are simply not always delivering the intended results. They are not enough. And I believe that the failings in these cases demonstrate that more must be done to ensure that dementia patients receive the best care possible and to ensure that they receive dignified treatment at all times. I therefore hope that management at Barnet Hospital will reflect carefully on the matters raised by my constituents and which I've set out this evening. Mr Deputy Speaker, care and support for people with dementia is one of the most important challenges of our generation. It's a task which is only likely to grow in scale when in years to come around 1 in 3 people born today are expected to develop dementia. We must ensure that every one of those people has access to high quality health and social care. That means continuing to increase resources for the National Health Service so that staff can give each patient the time and attention that they need. In this financial year, the NHS resource budget is due to be £157.4 billion. It's due to reach £162.6 billion in 24-25. And of course, I welcome the announcement this afternoon by the Chancellor of a further £5.85 billion. So the total is higher than ever before, meaning the NHS has more hospital doctors and nurses than ever before, and it's delivering more appointments, tests, treatments and operations than ever before. But if we're to relieve pressure on the NHS and tackle waiting lists and ensure every patient gets the best care, we do need to tackle delays in discharging people back into care settings in the community. To do that, it's essential that we fund local government to play its part, and I welcome substantial increases in funding for social care over recent years. But the cost of social care continues to place real strain on council budgets. And if we're to have the care home places we desperately need, care providers also needed to be paid a rate by councils sufficient to provide the level of care needed by people with dementia. We must also have a long-term strategy for the social care workforce to ensure that we train and recruit the people we need to carry out these vital roles and that we pay them appropriately given the importance of the job that they do. And now that the government science and research budget is one of the biggest in the world, we should give high priority to dementia research to tackle this massive epidemic. Lecanemab and donanemab represent an incredible breakthrough, finally a glimmer of hope, the first ever drug shown to address the disease itself rather than its symptoms. And we must ensure that the NHS is ready to start delivering these treatments once final approvals are given. That will require a step change in testing capacity so that we identify people who can benefit from the drugs in time for them to have an effect. And finally, Mr Deputy Speaker, as a society, we must do everything we can to support unpaid carers, including with respite care. According to the Alzheimer's Society, around 1.8 million people in England provide some form of care and support for friends or relatives with dementia. The overall value of those services provided amounts probably to £12.2 billion. So I want to conclude this evening by paying tribute to every carer who looks after a loved one with dementia, including the 6 brave individuals who spoke to me about their experiences and prompted this debate today. They are all heroes to which this country owes a great debt of gratitude. They deserve our deepest thanks and our support. Thank you, Mr Deputy Speaker.
Minister, Helen.
Thank you, Mr Deputy Speaker. And can I sincerely thank my right honourable friend for Chipping Barnet for securing this adjournment debate this evening and the very powerful speech that she has made. really bringing to life through the examples from her own constituency of people's experiences in hospital, some very difficult stories to hear, in fact. And I'm very sorry to hear of times when it sounds like the care for people's loved ones has fallen short. And she's made some really powerful points which I want to address this evening. I mean, it's starting with the fact, and as she said, that there are many thousands of people living with dementia at the moment, and this number is only expected to increase, indeed to get to over 1 million by 2025. And many people with dementia will be living also with other health conditions. And in fact, at the moment, it's estimated that around a quarter of the beds in hospital are being used by patients with dementia. So making sure that there's the right care for people when they are in hospital with dementia is really, really important, as well as doing our utmost, in fact, to avoid unnecessary admissions and make sure that people are discharged on a timely basis from hospital. And I think one of the points that I think is really worth emphasising is the point she made about dignity and the fact that every single person counts, whatever stage of life they're at, and particularly the dignity and the challenges to make sure that people living with dementia have that dignity, particularly when they are in hospital. And actually, can I also, as she did, pay tribute to the many carers, unpaid carers, who are looking after their loved ones with dementia, because I know what a huge burden and challenge that can be. However much you love somebody, there's a huge demand on you when you're caring for somebody with dementia. It can be very difficult, it can be very distressing, it can be absolutely relentless, however much you love them, and I very much pay tribute to all the carers who are doing that. My right honourable friend spoke first about Lisa Rutter, who very sadly lost her mother with dementia during the pandemic, I believe in hospital, if I heard her right. And can I thank Lisa Rutter for the work that she's doing as the founder of Dementia Club UK. Fabulous to be doing that and supporting other people looking after loved ones with dementia, or those indeed with dementia themselves. And she talked about her mother's time in hospital and how, for instance, she knew what her mother needed but feels that wasn't listened to and feels that may have contributed to her mother's death. And she also talked about the visiting restrictions during the pandemic, and I will talk about that in a moment. I heard her also talking about another constituent, I believe it was his wife, who was in hospital, who rightly talked about the importance of mobilising somebody with dementia and how she was nearly given the wrong medication, possibly would have been a fatal dose, and the importance of his intervention there. I think she also spoke about the care of her father, again talked about the importance of mobilisation, and then also about some of the communication challenges of somebody in dementia. She talked about one person who had been screaming all night, as described by the staff, but actually their family member who knew them, that was them calling for help and that they needed to go to the toilet. And I think that really brings to life how difficult it can be when somebody has dementia and is not necessarily able to fully articulate their needs or what they want. Those who know them well often will know what it is that they are trying to say or trying to communicate, but how difficult that can be in hospital when they may be being looked after staff who simply just don't know them well enough to know what they will mean. She talked about the circumstances of food, for instance, left uneaten. If somebody's not eating in hospital, clearly they're likely to lose weight and their condition may deteriorate, as well as medication being stopped. And then she also talked particularly about somebody whose partner had early onset dementia and how he'd been coping fairly well at home. He'd walked into A&E, and then that was very sadly the last time he walked, really emphasising this challenge with keeping people moving and maintaining the ability to be mobile while during a hospital stay. And again, what she's, I think, described as a fight to visit outside the visiting hours. And I very much heard some of her ask to do with visitor access, volunteers being trained in dementia care, training for staff, and avoiding discharge delays, amongst other things. And I will pick up on some of those things first. I mean, coming firstly to the challenge of caring for people with dementia when in hospital. I know many hospitals have worked really hard to do better for patients with dementia, for instance, creating dementia-friendly environments, changing the colours, changing the layouts, making sure that staff are trained in dementia care, having dementia lead nurses, and indeed training volunteers as well. And there is sort of standard training available through NHS England for staff and volunteers, indeed, to be trained in caring for people with dementia. But clearly she described examples where, as I said, the care has fallen short. And I have no doubt that across the NHS, as well as the work that's already going on, I'm sure that we can go further. And I will also raise the points that she has made about some of the care in secondary care with my colleague, the Minister for Secondary Care or Hospitals, so that we can work together on making sure that that care is right in hospitals. He also has oversight of workforce, and we should focus on whether we're making sure that the training that I know is available is really being taken up by enough staff, considering the number of people in hospital with dementia particularly. On visiting, she spoke about a subject which is very close to my heart, and having been involved in some of the decisions to do with visiting restrictions in social care during the pandemic, and knowing how hard those decisions were to make and the weighing up that was being done between infection control concerns versus making sure people could be there to spend time with loved ones, we have been putting in place changes to CQC regulation to make visiting a fundamental right, a fundamental part of care, fundamental standard of care, in order to make sure that there is a better access for loved ones to their family members in care homes and also in hospitals, knowing particularly how important this is for people with dementia, amongst others. CQC is currently consulting on the implementation of that change to regulations, and that will be live very shortly. So I really believe that we have taken a significant step in addressing the concerns raised about visiting there. One of the things my friend spoke was about faster discharge, and I'm very alert to the risk for patients to decondition in hospital, but particularly that for patients with dementia. That's why over the last year or so we have worked really hard with the NHS to get better at identifying patients at greater risk of deconditioning, particularly those with dementia, on their admission to hospital, earlier discharge planning, getting care transfer hubs established all across the country who will do the work around a more complex discharge, which can often be the case for somebody with dementia who may need more access to social care. And indeed to increase the access and availability and the supply of social care so that that is there for those who will need it when they are leaving hospital. And we have made some real progress on that over the last year. I've actually got very little time, so I'm afraid I won't. Also, we have, and she talked about the social care workforce, another subject very close to my heart. We have a strategy for the care workforce. We are building care as a career particularly to boost recruitment and retention amongst our homegrown workforce. We have the first ever national career structure for care workers recently published, and we are launching a new national qualification to boost that supply of care workers. Avoiding admission is another priority for me. So clearly some people must be in hospital for the treatment they need, but we know that they're particularly patients with dementia, can really deteriorate in hospitals. So we're doing more work with the National Health Service and social care to do more to avoid admission when this isn't truly necessary, putting in place alternatives to being admitted to hospital, or indeed on the other end at discharge to support earlier discharge, the rollout of hospital at home or virtual wards, where as part of our urgent and emergency care recovery plan, we committed to at least 10,000 hospital at home, so beds or equivalent, and actually have over-delivered on that with the NHS. So we now have over 11,000 hospital at home beds, which do exactly that, help people who would otherwise be in the hospital receiving acute care, receive that care at home and be able to recuperate at home and avoid that risk of a longer hospital stay and deconditioning as part of that. My writer friend talked about dementia research and the new treatments coming on stream for dementia. As a government, we have committed to doubling our investment in dementia research during this Parliament, and we are on track to do that with our dementia mission. We are also working very closely with NHS England to be ready for new treatments coming on stream, lecanemab and donanemab, of which are breakthrough treatments. I should be clear that we know very well, and I've received some clinical advice on this, that these treatments do have quite significant side effects. They won't be suitable for everybody. So this is why I put a note of caution in there, and clearly we're waiting to hear whether they are approved by the regulators, by MHRA and by NICE. But in the event that there is approval, the NHS England is indeed making the steps to be ready to put in place the levels of diagnosis that are required for that, and to be able to support those new treatments. And that's hand in hand with work that we're doing with NHS England to improve the diagnosis rate for dementia. We have a target of 66.7% dementia diagnosis rate, which dropped during the pandemic because of dementia services having to be closed with dementia assessment. But that has been gradually building up, and I'm expecting NHS England to get back up to that level during the course of this year. And that's really important, because having a diagnosis helps people access the support backup that they should be receiving, both actually the individual with dementia, but also their carers, for example. I am conscious of the clock ticking, so I have tried to cover some of the territory that my right honourable friend set out in her speech. Which, as I said, I thought was very, very powerful, raising these really significant issues for both those with dementia when receiving care in hospital, and also for their carers and their loved ones. I completely agree with her about the importance of having dignified treatment and treating people with dignity. Those with dementia, treating them with dignity at all times, and how I know this can be particularly challenging in hospital, but we have to make sure that that is the case, as well as making sure that we get all the care that is needed in place outside hospital, avoid those unnecessary admissions, support people to be discharged quicker from hospital, get ready for the arrival of new treatments for dementia. And actually, another thing I will say while I have a moment on this is raise awareness that a significant proportion of dementia can be prevented, or at least delayed, through us own looking after our own health. And in fact, the risk factors for dementia are similar to the risk factors for heart disease and other things, and that's something which actually there's relatively low awareness. So while we know that we will see more people with dementia in the years ahead, actually we can also do more to raise awareness of what you can do to maintain your own health and stave it off. But actually, I'm just coming to a close. So I say thank you very much to my right honourable friend for raising this debate, and I will continue my work to pursue these topics that we have discussed this evening. Thank you.
The question is that this House to stand adjourned. Does many of that opinion say aye?
Aye.
Contrary, no. The ayes have it. Order, order.
proceeding has ended. The 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 proceeding has ended.